My name's Lisa Christian. I'm Associate Clinical Professor and the Associate Director of Clinical Education at the University of Waterloo School of Optometry and Vision Science. And today I'm going to be talking about introducing clinical reflections to healthcare learners. PebblePad was used in our first and second year clinical experience course, and I'll go through how we utilized PebblePad throughout the course. In this course, students were assigned 3 half-day clinic sessions in our optometry clinic and observed patient care encounters. Our students, the learning objectives for the students were to describe, discuss, and reflect upon the interactions and communications between the student and the patient, the student and the optometrist and the patient. A bigger learning goal for this clinical experience course was to introduce and integrate personal reflections, and here we're talking about self-reflection, empathetic reflection, and reflective communication as a means to foster critical thinking. So in healthcare, reflective practice is noted as a key component for learning through practice and for professional growth and development. Specifically in this clinical experience course, we wanted to incorporate written reflections to help the student promote a synthesis between didactic learning and clinical application, as well as provide an awareness of personal biases and beliefs with regards to patient care. So we did this by utilizing PebblePad. And so we created a workbook in PebblePad, and there were different contents within the workbook. The first one was an introduction and objective for the course. There was a reflection rubric that was created here, and this was used to guide the student when they were writing their final reflection paper. And then the students had 3 clinical experience sessions in which they documented their clinical experiences, and then they were able to write reflection notes after that experience as well. For the clinical experience worksheet, this was used to document the observed patient encounters and to serve as a patient log. This way the student was able to review patient cases for future coursework, and it also allowed myself, the course instructor, a way to see types of patients the students were observing and provided an opportunity to modify the clinical experience sessions to enable the students to observe a wide variety of patients. In this worksheet here, the students had to record their observation date, the year of optometry they were in, whether they were in first or second year, the types of patient encounters, so they included the patient initials, the reason why the patient came in that day, and then what the final diagnosis was. They indicated the types of encounters they observed, and then at the end they kind of rated their clinical experience. We also utilized the supervisor signature function. So the signature function allowed us to confirm that the student did attend the clinical experience session, and then also allowed the supervisor to confirm that the information that was put in the workbook was correct. The students were able to complete the worksheet while in clinic using any device with a touchscreen, such as their phones or iPads. The signature feature, the supervisor was able to sign off using that touchscreen, and then they could just save it right on site. Following the completion of the clinical experience session, the students had 2 days to complete their clinic reflection notes. Here we created another asset in PebblePad and followed the clinical reflection framework of what, which was here, so what, and then at the end, they wrote down notes about now what. Once complete, I would review both the clinical experience worksheet and clinical reflections and would provide comments to the students. What was nice about this feature is that if the student had any comments to send back, they could also write them here, and this way both the instructor and the student were able to reflect back on the feedback later in the course if needed. A scorecard was used throughout the term so the students could see how they were doing. When creating a scorecard, you can label all your assignments and assign an appropriate weighting. And so as you're grading each one of the notes or the assignments, I was able to go ahead and put down a number to indicate how well they were doing. And then at the bottom here, a total score would keep accumulating such that at the end, the total score would be out of 100. Once all the clinical experience sessions were complete, the students were asked to write a final reflection using their clinical reflection notes. A rubric was provided for the students so they knew what was expected for their final reflection, and they were able to complete their final reflection using PebblePad here. When grading the final reflection, I used the feedback template feature in PebblePad. This enabled me to grade the assignment using the reflection rubric. And so using the feedback template, you would just go ahead and put the student's name here. And then you can go ahead and assign each one of these boxes as marks. For this assignment, it was 55% of the student's grade, which is why the final reflection was out of 55 points, and that was converted into a percentage, so the students can easily see how they did. At the end, you can put the final reflection grade in the scorecard, and then the student can easily see how they did on each one of the assignments, and then the total score would be their final grade for the course. Once all the final grades are generated on the main course page in Atlas, you can see everyone's final grade. The green arrow indicates that the feedback and the grades have been released to the students. And if you wanted to see how everyone did on each one of the assignments, you can click on Show Scorecard Information, and here it kind of breaks down everybody's grade as well as the total grade, so that it's easy for you to compare each one of the students and to see how well everybody did throughout the term. As mentioned in the beginning, the goal of this course was to introduce our first and second year students to personal reflections, and to do so, we will continue to be utilizing PebblePad as the student progresses through the optometry program. So in their third and fourth year, the students will be reviewing these early written reflections and will continue to build on these submissions as they begin to reflect on their clinical experiences as student clinicians, and when they graduate as reflective practitioners.